Come learn how Usain Bolt doesn't let his scoliosis slow him down. Scoliosis is an unnatural sideways spinal curvature. A scoliotic spine doesn't only bend, but it also has a twist or rotational component which causes it to be a three-dimensional problem. And normally the twist is into the concavity of the curve. In order for a scoliosis to be diagnosed, the Cobb angle measurement needs to be 10 degrees or greater. A Cobb angle is a measurement that's taken during a scoliosis x-ray that tells me how far out of alignment the scoliosis is, or what severity does the scoliosis have. So how scoliosis affects each and every patient is completely unique. It depends really on the patient age, curvature location, the condition type, and of course the severity. How severe the scoliosis is isn't always related to how it impacts the person, meaning somebody could have a severe scoliosis, meaning 40 degrees greater, and have very little impact, very little pain, very little functional concerns, and somebody could have a more mild scoliosis and have more severe impact and pain and discomfort. But one thing we do know is scoliosis introduces uneven forces to the body, and it's this uneven forces that can possibly cause more concerns and compromise function. In children and adolescents, these uneven forces can disrupt the overall body symmetry, and the main form of deviation or what you see is postural deviation. That's the main symptom. The main thing that brings out diagnosis is some kind of postural deviation, uneven shoulders, uneven hips, uneven ribs, something that you see posturally. In adults, the postural deviation occurs as well, but the main symptom that brings out diagnosis is pain because the spine is compressing as a result of gravity over time. Now, scoliosis is more painful in adults for this exact reason. Scoliosis does not become compressive in the adolescent stage because they're growing, and as they're growing, this is what possibly could worsen the curve. However, once the spine has reached skeletal maturity and they're no longer growing, we move into something called compressive scoliosis. And compression of the spine and surrounding muscles, nerves, and tissues can compress as a result of gravity, causing the curve to progress, but now it also causes scoliosis-related pain. And this type of pain is more likely to occur in adults. In children and adolescents, I said, the constant growing is what counteracts this compression, but since growing can occur quickly, the curve can progress rapidly. In adults, the compression is what causing the progression over time. This is a result of gravity, and this is much slower. Now, despite having this structural spinal condition like scoliosis, you can see in somebody like Usain Bolt how proactive treatment in adults can still have patients be able to thrive and accomplish amazing things like Usain Bolt did. Now, who is Usain Bolt? He's actually a world famous athlete with severe scoliosis in his thoracolumbar area. He is known as the world's fastest man. He's the most decorated sprinter in history, 8-time Olympic gold medalist. And to think that somebody would have a scoliosis can be that functional with speed in a very compressive sport. Well, how can somebody like Usain Bolt overcome the challenge of scoliosis and symmetry and achieve these types of things? Well, it's this gritty determination that it takes to be a world-class athlete. When you apply that type of determination to a treatment option that is very, patient dependent, meaning how involved the patient is into the treatment normally means the better results. Well, Bolt's conditioning and and how his stride was, because he had an irregular stride as a result of his scoliosis, forced him to train to how to optimize his abilities to make that stride as symmetrical as possible. And it goes to show you that optimal training can reprogram somebody's stride and somebody's postural alignment to allow them to function at a very high level. So early on, his scoliosis was a problem because he was getting repeatedly injured. So he looked to using different types of treatments, not surgical treatments that would limit function, but more conservative treatments focusing on strength and function, mobility, and chiropractic care and exercises. And since he's committed to a more conservative type of approach, this is what keeps Bolt, his core and his back strong, and his scoliosis doesn't hinder him like it possibly could hinder other people because he's been committed towards this conservative treatment approach. Now, conservative treatment approach, I like to call them a chiropractic-centered treatment approach, is a non-surgical approach option. And the goal is to maintain function. Surgery, by definition, is a non-functional approach. It could make your spine straighter, meaning surgery, they'll use screws and rods and they'll force your spine into a straighter position, but you lose function at the very core of that fusion because by definition, when you fuse the spine, you eliminate function. So you're sacrificing function for alignment. In a conservative chiropractic-centered treatment approach, we're trying to restore alignment with maintaining functions. And normally this integrates multiple forms of treatment. And these treatments are normally trying to reduce the size of curve. They're focused on something called structural rehabilitation, not only to increase core strength, but really to reduce the spinal curvature by making the spine straighter and then supporting that with muscles and exercise and treatments like that to help support the strength of the spine around this straighter position of the scoliosis. Conservative treatment strives to preserve spinal function. You can imagine if somebody like Usain Bolt had to go through spinal fusion, how much function of his spine would have been lost during that treatment option versus the treatment option that he chose, which allowed him to become, the world's fastest man. So there was a time that we really thought that scoliosis would always mean that you have a life of restrictions and a life of limitations, and there would be not much you can really do. Thankfully, we've learned much about the condition over the years, but more importantly, we've learned about approaches that can be more functional, very similar to what we use here in Scoliosis Reduction Center, to help to combine chiropractic techniques, core strengthening, sports rehabilitation, gait therapy, traction techniques, percussion therapy, scoliosis-specific exercises, isometrics, and this whole combination of treatments to help us produce a very successful approach in helping reduce scoliosis. Now, you notice I mentioned a bunch of things there. One problem with all these options is the care can sometimes become fragmented, meaning a lot of patients can do a lot of these things, but since nothing is coordinated by one doctor overseeing the entire program, somebody can do exercises, somebody can do chiropractic care, somebody can do therapy, somebody can do physical exercises, go to exercise physiologists to get home rehab, and they're doing all these different therapies, but nobody's working together to make sure that everyone adds. So the second thing is not only do we need to have a combination of treatments, but they have to be coordinated. They can't be fragmented. So making sure that these things coordinate is also one of the most important things when we look at a functional approach to restoring or reducing scoliosis, so it has the least amount of impact over somebody's life.